Coming up on this edition of Southwest TV News. As the Cypress Health region prepares to finalize its budget for the 2015-16 year, it's reporting a surplus of $3.6 million. As we make our way through the middle of April, the temperatures have varied through the past several weeks, from the teens to hovering around zero. The new Southwest Integrated Healthcare Facility in Maple Creek will officially open its doors on June 25th with a ribbon-cutting ceremony. Thanks for joining us here today. The Cypress Health region is reporting a financial surplus, but on the downside, they have numerous staff vacancies. We have more in today's top story. As the Cypress Health region prepares to finalize its budget for the 2015-16 year, it's reporting a surplus of $3.6 million, an increased pool of money due to 3 times the staff shortage across the region from last year.
Yeah, last year I think it was around 1.1 million in staffing shortages. This year it's going to be around 2.9, which is considerable, and it's all over the map this year. I can't pinpoint one discipline that we would be overabundance of shortages, but it's everywhere.
And despite ongoing recruitment efforts using a variety of resources from job fairs to social media, the health region is faced with numerous vacancies in the areas of professional healthcare staff to maintenance. A hurdle which CEO Beth Vachon says is common across the country.
I think there's lots of other opportunities for people now. Again, the unemployment rates are really low, and healthcare it's challenging, and it's sometimes can be shift work is hard. You know, people have other options and may choose those. When again the unemployment, there's lots of jobs available and people are working. So I'm not sure what the solution is and how we actually encourage people to stay in smaller rural communities and work and live there and, contribute to, their community from that perspective.
And as the Cypress Health region strives to follow its mandate of providing quality care for residents across the Southwest, Vachon indicates there is one area they're struggling to fill key positions in.
Well, I'll give you one example of where we are challenged, and it's to find home care aides who, are willing to drive all over rural Saskatchewan to provide care in people's homes. So, we're challenged there, and we would like to be offering a higher level of service where we can. Of course, the goal is always to keep people at home as long as they can. So, that's just one example of where people may be noticing that, we're struggling to make sure we've got the right staff in the right place at the right time to be able to, provide those services for people.
The Cypress Health region provides health care services to a population of approximately 44,000 across southwest Saskatchewan. More details on employment opportunities with the health region are available online.
The future is here. Saskatchewan's fastest internet with unlimited usage and blazing speeds. Infinite. Watch for it in your neighborhood, only from SaskTel.
Well, if you're like many looking forward to spending more time outdoors, warmer weather is on the horizon. We bring you this latest update from Environment Canada. As we make our way through the middle of April, the temperatures have varied through the past several weeks, from the teens to hovering around zero. A trend which Environment Canada says is common for April, as we make the transition from winter to spring.
One of the things that happens with April is that as you move along, those kind of warm days begin to outnumber the cool days. And so can never rule out a return to temperatures that would be below freezing, for example, the minimum temperatures. But, it's been a long while since you had an all-freeze day. I think there was only one day in the last month where you didn't have at least some kind of melting. Every week we gain about 2 degrees in the Swift Current area. That means that the average temperature, for example, right now might be around 9 degrees for a daytime high. Well, this time next week there'd be closer to 11.
And as we all keep our hopes up for warmer weather and budding trees, a warmer airflow is on the horizon.
And in the long term, what we're seeing for the months of late April into to May, we're showing conditions that are going to either be what we would describe as maybe normal to maybe a little warmer than normal. But I'd emphasize the near normal kind of conditions. So we think that mid-spring to late spring will be typical, better than last year, and then we're still calling for a summer to be warmer than normal. So I'm thinking from an agricultural point of view, hey, the weather looks fairly positive, and but with a little bit more moisture. I think that you went through the winter with down about 15%, and I would think that most growers and ranchers would not turn a blind eye to having a little bit of moisture.
The seasonal high for this time of the year is 11, with an overnight low of -3.
Hopefully that as we hear the stories and see the stories of how people are giving for good, how people are affecting positive change, we'll be able to then reflect on our own lives and see indeed what can we do to give for good. And even more than that, what are we doing to give for good? What are we doing to affect change? And as we notice that in our lives, I think we will find that we are our own inspiration to even give more for good, to affect more change. And as we see what people are doing, I mean, many times it'll be, hey, that's something that, I saw somebody doing just that. Or you know what? Something similar to that happened in my life. You know, what they did for that person, somebody did for me so long ago, and that's inspired me to do this, and the next thing. So I think the give for good thing, the inspiration behind it and the motivation for each of us to actually take a look at ourselves, see what we are doing for good, and to draw inspiration from that to give for good even further, I think that's a whole big part of it.
I played for the Swift Current Broncos for a short year and a half. It was unbelievable. I met new people that I became great friends with. Putting on a WHL jersey, semi-pro, it's pretty unbelievable just to make it to that goal. It was in practice. Just a whole bunch of pucks were scattered on the ice. One of my best buddies stepped on the puck. I was on the boards talking to a coach. He slipped, fell, took out the back of my legs. I ended up falling back, hit my head. At first, I thought it had just been a normal concussion. I was treated by many doctors. I was sent to Calgary many times to see neurologists. Couldn't really figure out. They just kept saying it's a timeline, a waiting game. It's been ongoing for 4 years now, I believe. Still have the symptoms, headaches. Dizziness has gone away in the past few months, but biggest thing is my headaches, about 4 years now. Well, at this point, right now, I am in training to be a personal trainer, which I'm very happy to be, making people's lives healthier, fitter, and better. In addition, I became a businessman for a health and wellness product called Kyani, which also ties into my personal training because it is a wealth product that will also make you healthier and even feel more energetic. And I personally myself am a user. Feel active. I feel more energetic than I ever have. I've used it to finishing my course, to going to the gym, to just going for walks. I feel motivated to do anything. It's just basically made me a more happy person.
A long-awaited new healthcare facility for Maple Creek is set to open in June, bringing together a number of healthcare services all under one roof. Following months of construction and unexpected delays, the new Southwest Integrated Healthcare Facility in Maple Creek will officially open its doors on June 25th with a ribbon-cutting ceremony. And as the finishing touches are put in place within the facility, a number of training sessions are occurring for frontline staff. through a process known as value stream mapping.
Definitely, I think it will help us in Maple Creek just because we've had the opportunity to actually design the primary health care, for example, exactly in the way we want it to work and function. So there'll be lots of opportunities and ways that we can look at what we've looked at in Shaunavon and discovered on how their processes happen, and help then the staff as we're orientating, how that can work there.
And from a patient and client perspective, the transition into the new facility will span over a number of days.
We're shooting now for June 1st to be up and running as far as around that date. So, sometime around the beginning of June, looking at getting our, ER up and running and all of those services ready to go. We will move one long-term care house at a time. So we'll get a house settled, move the next house. So over a 3-day period. So, by the 10th of June, I think we'll be well operating that building. Everything will be up and running by then.
Once open, the Southwest Integrated Healthcare Facility in Maple Creek will offer 80 patient beds and a variety of client services all under one roof, including primary care, telehealth, acute admissions, and long-term care. Construction for the new Southwest Integrated Healthcare Facility is valued at $45 million and will serve the residents of Maple Creek and the surrounding area.
The future is here. Saskatchewan's fastest internet with unlimited usage and blazing speeds. Infinite. Watch for it in your neighborhood, only from SaskTel.
Well, this brings to a close another episode of Southwest TV News, reporting the stories that matter to you. We always welcome your news tips. You can always reach us here by phone at our studio or by email to contact us at southwesttvnews.com. Also, be sure to join us daily online for the latest news from across Southwest Saskatchewan and so much more at mylocaltv.ca. And be sure to follow us on a range of social media. Thanks for joining us here today. I'm Carol Andrews.